Hi, welcome back to the Dr. Paul Show. Today I have a really special guest on who I'm excited to talk to you. She was bringing her stepson in along with her husband. His name is Milo, and he is in grade school, but he, when I first saw him, was in pretty bad shape as far as behaviorally, really getting a lot of problems at school. And so I wanted to really have her come on and explain like how much better she's doing with a couple of very quick interventions. Within 2 visits with me, he's really turned his life around. So I wanted her to share his story. So thank you so much for coming in. I really appreciate it. You brought in your stepson, right? A couple months ago or so.
Yes.
So tell us about his history, about before you brought him to see me, and what, how long you've known him, since what age, and.
Well, I met him when he was 2 years old.
Mm-hmm.
That's when I started dating his father.
Mm-hmm.
And we didn't have him full custody at the time. He was with his mom, biological mom, most of the time. And it wasn't just until recently, this past November, that we got full custody, partly due to his behavior, his conduct at home. Mom couldn't really handle him, and where she lived, there wasn't anyone out there nearby in terms of like mental health resources. It's up in the Fresno area, so
Right.
Just no access to care up there. So when we got him full time in November, it was almost like the first time meeting him again, because he's there every day now. It's not just vacation or on any breaks. So the behavior was completely different. It wasn't just, okay, I'm on vacation with my mom's. It's like, oh no, I actually live here,
Right.
and I have to follow
What
rules.
age did he start exhibiting any behaviors?
It was about when he was, I want to say around when he was 4. That's when he started getting very hyper. He just wouldn't do any activities, like he wouldn't be able to sit still, and just destructive kind of attitude. That's when I first started noticing around 4 or 5. That's when he started, I could see the negative emotions showing, and him not being able to be redirected. Also, he wasn't able to go to, I think pre-K. I don't think his mother put him in pre-K. And when he was in kindergarten, that was during COVID. So he didn't go to kindergarten, and he didn't go to half of first grade, because every time he had a runny nose, they sent him home. So he missed 70% school.
It was a difficult time.
Difficult time for sure. But also I do believe that it wasn't just the runny nose or the excuses that the staff had. I do believe that it was behavior related, where it was just easier to send the problem child home, because you want to deal with the other 30 in the class or whatever was out there. It wasn't until after we got him in November of last year that, mom started actually talking to us about his behavior and things that he's done with her, things that she kept from us. But the conduct disorder definitely started around 4 or 5.
And probably it's hard to know at that age. Is it just an active boy? Is he just a boy being a boy? And that's sometimes it's like, where's that line? But it sounds like he had kind of crossed the line. You expect that, but you don't expect necessarily destruction. And when was he first evaluated medically, and what was like the first diagnoses that he was labeled with?
He was first diagnosed in January of this year by a neuropsychologist, diagnosed with.
And he's 9 now, isn't he?
He is 8.
He's 8, so from 4 to 8, he had no treatment at all?
No.
Wow.
We tried to get mom to get him evaluated, but she just gave us a bunch of excuses, and it's hard to do something when the child is 4 hours away.
Right.
And it is what it is. It's just what happened. And also too, she was hiding a lot of the behaviors, so we didn't really know how bad he was until after we got him in November.
Mm-hmm.
And
was she afraid that if she told you all the truth that you wouldn't want to take him full time, or?
I think she was afraid that if she told us the truth, then we would petition to get him full time.
Oh, yeah.
She was trying to. I do believe she was trying to keep him as long as she could, even though she didn't have the resources for him. But yeah, he was just recently evaluated.
What you're saying is right about, she's in Fresno. It's hours away from here, but it's not that far in the big scheme of things. And the fact that you can't get good care in certain places, that's what's sad, because there are a lot of kids who need help, and they, just because of where they live and lack of access to care, they don't get treated, and if the kids don't get treated, it can lead to very bad things later on, like in teenagers. But so anyway, so he was first evaluated by who, and when they gave him the diagnoses?
It was, the pediatrician saw him and gave us the referral for the autism, to check to see if he had autism, and to check, talk about the conduct disorder. And that referral was the neuropsychologist, I was surprised. I wasn't too surprised by the autism diagnosis. His visualization skills are very high. He's always had being able to think about things and solve puzzles and work in like 3D space, 3D objects, stuff like that. He's always been very good. Even when he was very young, he's always had very good building skills. But there was the conduct disorder. He recommended, the pediatrician prescribed Wellbutrin, which after we tried that for about 3 weeks, didn't really do anything. Maybe for the first 14 days, had some kind of emotional benefit, but still
nothing great.
Still would go home and he would still go to school and just start, fighting with everyone, being very disruptive, being very irritable. And then we, reached out to you because my pharmacist was actually telling me that he needs to be on a Abilify, or like a mood stabilizer. He was actually the first one.
Well, even the pharmacist knew.
The pharmacist, yeah. My good friend, my boss. I trust him with everything. He's, a great ally to me, and talking me through the whole thing ever since we got him in November. And I was, I always tell him things, that he would do, because his godson has autism, conduct disorder, things like that as well, ADHD, and so. He told me, hey, he needs mood stabilizer. He needs to be Ritalin. Don't be afraid of the medication. And I told him, we're going to do our due diligence. We're going to get the diagnoses. And we did. And so here we are.
I think it was ADHD, conduct disorder, ODD, which is oppositional defiant disorder. Didn't he also had a learning disorder, I believe, right?
Yes.
Yeah. So I think what I did when I first saw him, I took the Wellbutrin away. Obviously, that wasn't working. I mean, I can kind of see what they were going with that, because they might want to try a non-stimulant first, but I would have been surprised if Wellbutrin would have worked and anything significant. So the first thing I did is I treated his ADD. Now, someone might think, you give a kid who's hyper ADD, it's going to make him more hyper. Absolutely not. So if you treat ADD properly, it actually calms the kid down, or even adults who treat it. If it's the right diagnosis, it actually is very calming. And people think, I'm going to be on speed, or I'm going to get all jacked up. That's not what happens. If that happens, it's the wrong diagnosis, or it's the wrong treatment, or it's the wrong dose. So what I put him on is with methylphenidate, so basically generic Concerta, which is I gave him the lowest dose of that, and he responded very well. He it helped him, calmed him down. It actually calmed him down, and helped his focus, and he was doing better at school. But then tell us, it was working, and then tell us what happened after that.
It was working, but then just after about 10 days, the misconduct started coming back up again. at school, and pushing teachers, pushing staff, kicking doors, things like that, where he just wants to burst out of the room. He wants to leave. And I've learned that that's part of the autism. They get overwhelmed, they want to escape. And he's tried to elope and escape from school, like walk home and just say, I'm not going to listen to anyone here. I'm going to go home. Like, I'm leaving. So that's when...
Wasn't he like throwing things at kids? And...
He was throwing rocks. He would always go after the staff.
Right.
He wouldn't go after other children.
Oh, really? Wow.
But he would go after people that he didn't want.
Like authority figures.
Yeah, authority figures. He didn't want to listen to. He's like, you're not my parents. He would tell them straight out, you're not my parents.
Oh.
I don't have to listen to you. You can call my dad. I listen to my dad. He's, even having the nurse administer his medication now, even then he would tell the nurse, like, I need to see what pill you're giving me. I know what it's supposed to look like. If you're giving me the wrong one, I'm going to tell my mom. Like, it's weird.
He's smart.
He doesn't want to listen to anyone but his family and his, like, people that he respects. Yeah. But that's part of the ODD.
Yeah, people think autistic kids aren't smart. They're smart. They're wise. They can tell. So when I heard that, I think didn't they give him like two recesses instead of one to get the wigglies out of him and get him outside more and try to...
The extra recess was to two-parter. One, to kind of repair the relationships with all the kids in class. He would flip his desk. He would, get in verbal fights with the other kids. If they started saying things to him, they'd have a yelling match. So I think the recess was like an olive branch, because he would be able to take someone from his class and pick differently every time. And so it's like, if you come with me, you'll get also an extra recess. So it kind of repaired some bonds, which it helped. And then the other part of it was to definitely get him out of the classroom, so he's not sitting in one spot. He doesn't necessarily wiggle. He just likes to pace or walk around. We tried this, the wiggle seat, the wiggle board, the bands, everything like that. He's not a wiggler. He likes to just walk. He doesn't want to sit in a seat if he doesn't want to sit in a seat. That's his thing. But
so that's when I think I put him on the Abilify. Now Abilify is actually, it's a mood stabilizer. If you want to be formalized, it's an antipsychotic. Now people might think, okay, he's not psychotic. Of course he's not. So why would you put a kid on that? Well, because it works, number one, or we give it for bipolar disorder. Now you can't really label him with these things, but what happens with kids is the stimulant helps get the flow better, but then you need a dopamine agent to kind of calm dopamine down, and that's what Abilify does. So you got the benefit of the stimulant, and if you don't add that, then the stimulant, the initial benefit of the stimulant is going to wear off, and then you're going to be left with the behavioral problems coming right back again. So, and people might think, oh, he's too young for that. No, he's not. I have a lot of success with kids with conduct. Whenever I see conduct disorders, ODD, behavioral issues, Abilify is amazing. The results are incredible. And he's on the lowest dose of it too. And he's only on like 2 milligrams, so which is really pretty low in the scheme of things. But tell us what happened after that was put on.
When he first started, the first couple days were a little rough because it made him really drowsy, and it made him completely calm, which was a little unnerving to see him just relaxed, because he's always moving.
You're not used to that.
He's always building, and if he's not building, he's drawing the next thing he's going to build. His mind is always turning. Even if we're just sitting there, he's telling me, he's like, oh, I should make this, or blah, blah, blah. His brain's always thinking about the next big thing. He's very creative, and just to see him for 3 days while we figured out the dose and titrated up, he was just completely calm, even though now we've moved it to where he takes it right before bedtime. Mm-hmm. During the day, he's still himself. He still has all of his ideas. He still has his personality. He hasn't changed or anything. That was my biggest worry, was that he would change, that he would lose that spark. But no, he's still the same funny, little crazy kid.
Right.
Right.
He's an active boy.
But he.
But it's more normal. It's a normality, is what it is.
Now he has friends. Yeah. One of the boys up the street, he comes over and they play together on weekends, and so he has his group now, his friend group, which is great. Yeah. Before he was alone, which just further rejection, making him even more upset. Yeah. But now he's able to, function in a group and go to summer camp. The things that he wasn't able to do before. We weren't able to socialize him while we were figuring out his diagnosis and his path or his medication. He wasn't able to be in a room with other people and learn how to act in a social setting, really. So.
Yeah, medications, they don't control a person. They put the person in control. And he couldn't help it. I mean, I'm guessing, what's mom's history? What's going on with her?
She has history of schizophrenia, bipolar, depression. She also has another child that's autistic, and then Milo's older half brother definitely has some kind of anger, ODD, right. ADHD. Right. You could just see it. Yeah. Which I feel bad, because now he's starting to spiral even more out of control.
Well, send them to me.
I don't know if she'll be able to drive out here, but I wish. Yeah. We keep telling her to.
Well, we can do virtual visits too. But that's why it's happening. It's happening because genetics is what it is. And with him, if we don't treat him when he's 8 and 9, when you get to 12, 13, 14, watch out, because it's going to get a lot worse. The behavioral stuff will get a lot worse. And basically, the reason the Abilify works is I call maybe pre-bipolar, because he's heading towards that diagnosis. But now he's not going to have to worry about that, because now that he's treated, he's going to have a much better adolescence. Let's say he gets a little bit older, we need to adjust the dose up a little bit. Exactly. If he maybe gets older, maybe we need to adjust the Abilify up to like 5 milligrams, which is still a low dose, but we might have to do that later, or adjust maybe the ADD medication has to go up a little bit when he gets older. But I think it was just 2 simple things like that. It just, it can turn, like I said, turn his life around. And when you turn his life around, I mean, it's much better for you and your husband. Life is better for everybody, really. And you treat one person, and it's amazing how it can really help other people, too. Not only you and him, but friends and friend groups, and so because otherwise, if we don't treat him, other kids are not gonna want to put up with that, and they're not gonna, and then he gets worse because now he's lonely because no one wants to be around him. It's just everything gets worse and worse. So thankfully he's doing great, and I think if we just keep treating him, he's gonna need to be continued treated. He's not going to be going off him anytime soon. I think he's going to just have a much better life, and he's got great parents, so that helps. So anything else you'd like to add, or?
No, I just wish that I guess my only thing is I just wish I got him evaluated sooner and pushed a little bit harder, even though he's not, my bio, kid. But, I just feel like I should have advocated him a little bit harder. I was so focused on getting the full custody that I didn't realize that the behavior would have been so bad. I feel like looking back on it now, I'm like, should have seen it in some ways, because when he was little, he refused to take showers. He didn't like the feeling of water on him.
Right.
And that should have been a little mini flag that he might be autistic, or he might have some kind of sensory thing, and my brain just wasn't prepared. There's just not enough. I guess people. I don't know how to really phrase it, but no one really is telling you what to look for. There's only kind of just telling you after the fact, after you see enough times. But
yeah, but that's not your fault. You saw that he had a problem. But again, unfortunately, most doctors you send them to, whether it's a pediatrician or whatever, and they don't know what to do.
Yeah, I feel that way.
Or they'll give them Wellbutrin but not a stimulant, or they'll give them a stimulant and then it stops working, but they don't know how to give Abilify that. So a lot of times, even when you advocate for a kid, you got to get them the right treatments, and you got to find a doctor who knows what they're doing. And that's not always easy. And again, especially like you said, in certain remote areas where they don't have a lot of access, and it's too bad because. Because like I said, if you identify genetics, then his brother, his mom, other people up the family tree are gonna, can be treated, and if you don't treat like a teenager, addiction levels are super high, and so that's what leads to a lot of addiction issues, and that's what. With a lot of like mothers, lose their kids because of that. It's just a bad situation all around when you don't treat these conditions that are actually quite easy to treat. So.
Yeah.
So well, thank you so much for coming on. I really, really appreciate it.
Oh yeah, no, thank you for everything you've done for our family. It feels.
It's been a pleasure.
Yeah, it's a good feeling.
Good.
Yeah.
Well, he's a kid. He's a good kid, so I really like him a lot. So, all right. Well, thanks.
Thank you.
The following interviews are patients of mine who didn't want to be identified, and so I'm going to be speaking with them over speakerphone, and we're going to be speaking about a variety of topics. So I hope you enjoy it.
Hey, thank you for having me.
Sure. I appreciate you coming on. So I know you've been my patient, I think, for like probably 7-8 years or so. So if you could share with us what brought you to see me in the first place, what happened prior to seeing me, and kind of walk us through then and now.
All right, yeah. Before I came to see you, I'd suffered most of my adult life with a misdiagnosis of depression, and basically was misprescribed, and went through years of all kinds of struggles through society with DUIs and self-medication and all the attributes that go along with, those high-risk behaviors and everything. And then you got recommended to me by a therapist after about my 5th or 6th DUI. I just gave up and said, I just can't deal with this anymore. I don't know why it's still happening. I'm seeing people, I'm being prescribed, nothing's going on. It's all the same stuff. So Dr. Barbara Grossman recommended me, and her words to me were, Brian, he's brilliant. He trains other doctors, so you need to go see this guy. And that's how I ended up in your lab. And I got to say, it was fairly miraculous in very short order that things got really squared away in my life. I'm hoping that's the way it is for everybody with you. But I've never been intoxicated since I met you. I've never touched a narcotic since I met you.
Wow.
I've none of that. I quit smoking since I met you. Everything got squared away in very short order. I've never had a manic episode. I think I got misdiagnosed because I wasn't depressed. I think I was bipolar. And it was the manic episodes that was taking me out, with the high-risk behavior and all the things that were getting me in trouble and, causing a lot of grief in my family life, a lot of financial struggles and, all the things that go with paying all those high insurance rates for DUIs and all the stuff that goes with it and all the court fines. And, but it was a pattern that, it got to a point where I knew there had to be something better than what I was dealing with. And what was going on with me was, enough was enough. The pattern was just ridiculous. So I was happy that Dr. Grossman had sent me over to see you, and I'm glad we got squared away.
Yeah, I think what your experience. You're right. What was happening when you get them in a manic episode, your mind's racing, and that's when a lot of speeding that happens with cars and drinking and driving without thinking about drug use, et cetera, high risk behaviors, and then what happens is when that passes, then you drop into like depression, and I think most doctors. most people don't go in when they're having fun. Most people come in. Most people come in when they're depressed. So if the doctors don't take a really good history, which is most doctors, unfortunately, you're going to get treated for depression. That's probably what happened before with you. You were treated for depression, and that wasn't working for you.
Right, it wasn't.
Yeah, so that's very, very common. And with bipolar disorder too, it takes about 7 to 10 years and 3 to 4 doctors statistically to diagnose bipolar disorder. I mean, that's a pretty frightening statistic. That's really frightening. It's very unfortunate.
I'm surprised I survived it, because I could have been dead 19 different times, to be honest with you.
Well, you're here for a reason. You're here for a reason. Yeah.
I hope so.
And right now, I think I have you on a combination of Wellbutrin, Topamax, Vraylar, and let me see here.
Occasional lorazepam, and when
Right.
things bunch up, but I don't take that very often, the lorazepam. I don't
Right.
take anxiety all that often anymore. In fact, I think it's less and less these days than it was before.
Yeah. So.
When I quit smoking, it's even less.
Yeah, and then I think this last time, which was really exciting, is I think about a half a year or so ago, I gave you Chantix. Yeah, I think it's funny because I mean, with nicotine, when no matter, people can give up narcotics, methamphetamines, alcohol, but nicotine at the end of the day is the most difficult one to go off of, and it's really, really difficult. And so I gave you Chantix, which is meant to be taken maybe a few months, but you were able to stop smoking. Even you were able for like, I think 6 months since the last time I had seen you.
No, it's been over a year now.
Oh, it's been a year?
Like
Okay.
11, 12,
Yeah.
about 14 months, because I think
Wow.
it was in March 11th was my sobriety date for smoking, and I started taking the Chantix, and I took it only for a month, and then within the first week, after the first week of taking it, I stopped smoking.
Yeah.
So, and then if I finished the Chantix for the next 3 weeks, but for my next refill, I didn't need it. So
Right.
I just kept going the way I was going, and everything was good. And I just, one day after another, and next thing you know, a year went by, and life is good. So
Yeah, I mean, there's
I've been struggling with cigarettes my whole life. So
well, it's a tough struggle, and to stop is very, very difficult. There's patches, there's gum, they don't work that well. There's there's Wellbutrin can work okay with some people, but you were already on that, and it obviously hadn't worked.
Right.
Chantix is specific. It's the best stop smoking medication ever invented. It actually attaches to the nicotine receptor side of the cell. So what happens is it attaches there, and it takes away the desire for nicotine. And it usually takes about a week to kick in, like the case with you. About after a week, and then I talk to patients and say, I don't want to stop smoking. It's too difficult, or I like it too much. I don't want to. And even though people say, I know it's not good for me, I know it's caused increased cancer, I know this, I know that, but I can't do it, because people just think I can beat this or that, but I just can't beat the nicotine. It's amazing with Chantix. I tell them, look, you don't even have to put the work into it. You just take the pill, let it do the work for you, and then you're going to stop, and it almost always works. It's really amazing stuff.
That's exactly how it worked for me. I mean, within a week, I just didn't feel like smoking anymore. It definitely did the work for me.
Right.
And I had quit before for, a couple times for a few years at a time.
Right.
Over 30 some years.
Yep.
But always went back to it. So I just could never get rid of it. But
Right.
With the Chantix, it was just like, after a week was like, I really don't need to do this, and I don't feel like doing it, so I'm not going to do it. And
Yep.
That was the end of it.
Yep. Great. Yeah. Well, I'm glad you're doing well. I mean, I think you've been kind of a model patient of mine. I mean, I think you've been a pleasure to work with.
I'm glad I ran into you. Otherwise, I'd be flapping in the wind out there for the rest of my life. I felt like I was desperate.
And you promised me you're going to bring some of that award-winning chili, right? I think
Absolutely.
All right. I'm going to keep you to that because I love chili, homemade chili, and I heard you say yours is the best, and
No, we went all the time with it in the competition, so we'll definitely hook you up.
That's the way to my heart is the way to my heart is with food. So
yeah, we'll even bring a red and a green because I think your wife might like
Yeah, I'll accept. I accept all donations. So.
All right, no worries. Yeah, next time I swing by, I'll bring one.
No problem.
So.
Well, I really appreciate you coming on. It's really, I think this is very, very useful. I think a lot of people are going to get a lot of hope out of what your story is. So thank you so much.
All right, I appreciate it.
All right.
Take care.
All right, you too.
All right, bye-bye.
Bye. So with him, with bipolar disorder, like I've said in previous cases, it's usually a dopamine and GABA. So before you saw me, most doctors are going to give SSRIs, Lexapro, Prozac, etc. And even in his case, my favorites, Effexor, Pristiq, those weren't for him either. So the typical antidepressants weren't for him. He did very well with Wellbutrin. So Wellbutrin is, again, it works on dopamine and a little bit on norepinephrine, not a lot, but a little bit. So that basically gets his depression better. Topamax, working on GABA, helps reduce his anxiety. But with bipolar disorder, you have to control dopamine. So with Vraylar, very good. We call it a mood stabilizer, or it's an antipsychotic, because mania can feel like psychosis. It's, the mind's racing, you get irrational, you do risky behaviors. So with the dopamine, we call dopamine antagonist, it kind of puts the brakes on, it puts a stop, so that way dopamine doesn't go too fast. Because without that, it would just cause more mania. But with dopamine, we have to, if we just do that without the Wellbutrin, then he'll be tired, he won't be motivated. If we do the Wellbutrin without that, he'll be manic. With both together, we kind of have a nice even flow of dopamine where it's going the right way, but it's not going too fast, it's not going too slow, it's just perfect. And I got the dose perfect on him. And then the Chantix, like I said, is a miracle product for smoking. Nothing ever been made like it. So, and like I said, some people say, I don't want to smoke. I say, try it anyway. And then they try it and they see how easy it is to stop smoking. And then they get that habit, because it's a pretty bad habit to have. It's not good for you, as most people know. So.